This is Modern Dental Assisting, Chapter 43, Restorative and Aesthetic Dental Materials, Part 2. In this lecture, we're going to jump to the end of this chapter and start with glass ionomers. Glass ionomers are one of the most versatile dental materials available. So glass ionomers do chemically adhere to the teeth, and the tooth preparation with glass ionomers is less extensive than what we would do for an amalgam or a composite. Also, with glass ionomers, they release fluoride after their final setting. This can help in cases where the patient may need an extra boost of fluoride. Indication for glass ionomer use would include primary teeth, final restorations in non-stress areas, such as class 5 and root surfaces. As a sealant, a core material for a buildup, or provisional, long-term, temporary restoration. Glass ionomer is resin modified and gives the material better strength, greater wear and resistance, and improved aesthetic quality. Metal reinforcement has a blend of silver tin alloy with glass ionomer, and this is going to provide a strong abrasion-resistant material that may be a little more long-lasting. When supplied as a powder and liquid for a cement manually mixed together on treated paper, we may use these for restoration purposes. Glass ionomers are supplied in either light protected tubes, cartridges, tubes, or pre-measured capsules. The material can be either manipulated with a spatula and placed in the applicator, or triturated and then placed in the applicator and then applied to the tooth and light cured. Temporary restorative materials. These are designed to maintain and restore function and keep the patient comfortable for a limited time. Indications for a temporary restorative material would be to reduce sensitivity and discomfort of a tooth until we can determine a diagnosis, maintain the function and aesthetics of a tooth until a permanent restoration can be placed, protect the margins of the prepared tooth that will later receive a fixed restoration, and then also to prevent shifting of adjacent or opposing teeth because of an open space. Intermediate restorative material, or IRM, is a resin-forced zinc oxide eugenol composition, and will include restoration of primary teeth in emergencies, as a caries management program, or placed as a base. With provisional materials, these are designed to cover the major portion of a tooth on several teeth for a longer period and may be able to withstand biting forces in daily wear. One of the most popular and cost-effective ways of restoring aesthetic appearance of teeth is going to be your tooth whitening materials. Whitening products can be found in many everyday items like toothpaste, fluoride, rinses, and then also with chewing gum. And most have a peroxide base. Teeth can be discolored from aging, using substances such as coffee, tea, colas, and then also tobacco. Trauma can cause discoloration, tetracycline. An excess of fluoride could create some discoloration, nerve degeneration, and then also with restorations aging. There are a couple different methods for tooth whitening available. We have a lot of offices provide an in-office service. So with these, we typically use a higher concentrate in the office. And a lot of times our patients can see their results in a short amount of time. At home is another method. These are just not of higher concentrate, still not something that the patient could get over the counter. A lot of times with our at-home whitening, we provide a higher concentrate, but then it also has the desensitizers within the whitening, so our patients hopefully wouldn't have the sensitivity that they may get with the over-the-counter products. And then, of course, our patients always have the option of buying something over the counter. Indirect restorative materials are fabricated outside of the mouth by a dental laboratory technician. These restorations involve a chain of procedures. So we would prepare the tooth, take a final impression. That impression then would be waxed, invested. A cast would be made then and finished and polishing of the cast, and then we would, in the office, cement the restoration on the prep tooth. Gold noble metal alloys. Gold in its purest form is much too soft for use in dental restorations, so we use a combination of gold with metals, forming an alloy. Noble metals used for cast restorations are gonna include gold, palladium, and platinum. We also have ceramic castings. So these are compounds, combination of metallic and non-metallic. So porcelain fused to metal, porcelain bonded to metal, ceramico metal, and porcelain metal. Porcelain is a type of ceramic most commonly used in dentistry. It has strength, translucency, and the ability to match natural tooth color. This is going to be stronger than our direct restorations. And the ceramic porcelain is fused to a metal backing shell. It's then fired and glazed solvent in the lab to produce a highly smooth surface, and it's extremely hard and very similar to enamel. Porcelain is going to provide a good color match. Um, so this would be aesthetically pleasing for the anterior teeth. It has the strength of metal and it's a good insulator to protect the pulp. And then it also has a low coefficient of thermal expansion.